Stop me if you've heard this. This month, Tori Spelling opened up to Us Weekly about the birth of her fourth child and how they almost didn't make it.
It was really scary. I mean, there were some very scary
You love
moments.
Tori Spelling.
Oh,
Let's
I think
put it out
she's
there.
so sweet. I really liked her reality show with her husband, Dean McDermott. But you know, with like a lot of women, celebrity moms have pregnancy troubles, but they also have very healthy babies, and sometimes they gain weight, lots of weight. In today's edition of Doc Hollywood, I sat down with Dr. Diane Horvath-Cosper. She's an OBGYN at HealthPartners Clinics to find out how every woman can relate to celeb moms. All right, doctor, we have to start with Reese Witherspoon. You know, she's 36. She just had a baby, little Tennessee, so sweet. So do you have any advice for women who are thinking about having kids as they get into their 30s? More and more women are doing that, right?
Yeah, it's a lot more common as women are pursuing career and deciding to have kids after they finish school or get established in a job.
This makes me feel better about my life. Okay, keep going.
The thing to remember at any age is to be in your best physical shape, maintain a healthy weight, maintain good nutrition, and avoid drugs and alcohol when you're planning a pregnancy.
Sounds good. Jessica Simpson just had a baby girl, and we've all seen her publicly dealing with her weight. A lot of women understand this, trying to lose the baby weight. She reportedly weighed 175 pounds after birth. She's 5'3" tall and was paid millions of dollars to try to get thin. So the idea, I think, for most women is, what is a healthy weight? What can we expect to gain? How fast should we lose it?
It's really important to gain weight at an appropriate amount in a pregnancy because your baby needs that extra energy that comes from the fat stores that you gain when you're pregnant. For women who are normal weight prior to pregnancy, they usually gain between 25 and 35 pounds as a normal amount. For women who are obese, it's a little bit less, about 11 to 20 pounds, but it's very important to gain some weight.
What about the idea you're eating for two? Have another donut. This is a great idea.
Yeah,
Thoughts?
that's not entirely true.
Okay.
The one you're eating for is quite a bit smaller than another whole person. You want to increase your calorie intake by about 300 calories a day in the first 2 trimesters and about 500 calories in the 3rd trimester. For most people, that's like a half a sandwich and a banana.
Okay, what about Tori Spelling? Tori Spelling recently had her 4th child delivered by C-section. Some scary moments for Tori Spelling. So what happened to her, and what were some of the complications that we were dealing with?
Well, one of the things that's unique about Tori Spelling is that she got pregnant, it sounds like, about a month after she delivered her 3rd baby by C-section.
All the moms out there are going, what?
That certainly increases a woman's risk for uterine rupture and for things like placenta previa, which is an abnormality of the placenta. It can be very dangerous.
So what does the uterine rupture mean? Because I think that's what sent her back into the hospital, right?
So uterine rupture is when the scar where the C-section was done inside on the uterus opens up and people can have bleeding. It can be very life-threatening. It's just good to know that the risks go up with an increased number of C-sections.
And then how much time should you wait before getting ready for the next baby?
Ideally between 1.5 to 2 years. It doesn't matter what kind of birth you have. It's probably best to wait at least 1.5 years.
Thank you so much. We appreciate your time. Good stuff, huh? I know. We want to thank HealthPartners Clinics and Regions Hospital for sponsoring the show. And remember to always check with your physician if you have any health concern.
All right.